In terms of transplant technology, the first time I was aware of it was probably in the 70s. I don't know if it goes before that, but it was that plug type thing. Was that the first incarnation?
You know, we used to think that the plug was the first dive into hair transplant surgery, and the first reported one goes back to the 50s. So the first published work about plug surgery was actually 1959 in the States, and was an American dermatologist, and he sort of exploded from there. Lots of people thought it was a good idea, and it developed over time, and I'll come to that in a sec, but actually more recently we found out that was not the first hair transplant. And now we know that actually the very first reported transplant took place in Japan before World War II. In the 1930s, there were documents that were lost because of war. It came to light maybe about 6 or 7 years ago. And the interesting thing is, it wasn't to treat hair loss. It was to treat people who have lost eyebrows for a variety of reasons. And the interesting thing is that the Japanese doctor performed work not too dissimilar to what we're doing today. Wow. So he didn't start with plug surgery. He started with, took a piece out and cut it into small little pieces and reconstructed people's eyebrows. But that knowledge got completely lost, and for the next, 20 years, nobody sort of took hair transplantation until that 1959.
So we would just kind of explain what plug surgery was for those people who don't know.
So, so the correct term for it is actually called punch grafting. Right. And a punch is like a drill bit. It's like a cylindrical, sharp bit that's hollow in the middle, and it punches out a piece of tissue, like a paper puncher, if you like.
Right.
And dermatologists to skin doctors to take a skin sample, and they do it now as well, to send it for a biopsy. It's called a punch biopsy, and they use this rounded tool to take out a punch of skin or punch of piece of scalp and send it to the lab to be analyzed. And so they already had the tool, but the doctor who did that in the 50s, because of his background, thought, I'll use this to see if I can transfer hair growing tissue from the back of someone's scalp to the top, and it worked. And he didn't think of any other way to do it, because he thought, that's a good way to do it. And at that time, people were just happy to grow hair.
I mean, did it work?
Absolutely, it did work. It worked extremely successfully in terms of growing hair. Unfortunately, it didn't look very nice because you're transferring these big rounded chunks, and it looked like what people call doll's hair or toothbrush effect. But it wasn't until around the mid-1990s that we introduced high-powered magnification, big microscopes to work with, and we're able to see that the hair at the back of your head and my head is actually in a particular configuration. It's not random, it's in a particular pattern, and hairs are in groups together, a bit like you can see here, although this is only showing one hair, but normally you can see one hair or you can see 2 or 3 hairs together, and they are groups that occur naturally, and they were called follicular units.
So they're not kind of evenly spaced?
So now what you're talking is about how we actually can get these hairs out of the head. So yeah, so we did was remove a strip. And that worked extremely well, but what it did, it gave people a scar line right across the back, hidden with your hair. And for the vast majority of people, not a problem, and it's still a big operation we do nowadays. But what happened is that over time, a lot of people didn't want the scar, because now a lot of men, young men especially, like to keep their hair very short, or like the option to keep their hair very short. So along the way, in the last 10 years or so, we figured out that what if we go back to the punch grafting, but what if we use really small instruments? Now that we have these big microscopes and big magnification, how about we use little things that are less than a millimeter? And now it's very fashionable to have your hair very short. Certainly has become more fashionable in recent years. So along came FUE, like you mentioned, which stands for follicular unit extraction. And what we do, instead of taking a strip of skin from the back, we shave the back of the head and use very small tools ironically, kind of on the same principle as what we talked about earlier, the plug graft or the punch grafts, but instead the tools that we're using are extremely small. They're kind of microscopic. So they range anywhere between, like the biggest one would be about 1 millimeter in diameter, and the smallest one is about 0.7 of a millimeter. That's really small. So instead of having a line going across the back of your head, what you end up with is tiny little dots, but hundreds and thousands of them. But if you cut your hair very short, it's far more subtle to the eye than a line. Clearly, there are advantages and disadvantages to either method, which I normally go through with patients at consultations. But it gives people the choice about what suits their particular circumstances.
So this is kind of imagery that, for me, is kind of slightly scary, which is that there is a punch that is going into your skin and taking out. I mean, how deep does it go? Because you just see. My memory still of the plug method of seeing the. I'm Asian, so obviously my parents wanted me to be a doctor. Right. So we're all having to live with the disappointment, and part of it is because I'm slightly squeamish. Yeah. So, when I kind of looked at pictures of the plug things, they look pretty dramatic and awful. So with these ones, how deep is it going? When you say it's taking the...
Yeah, so in your scalp, like the skin everywhere, you've got a layer of skin, underneath it is a layer of fat, and then underneath that there are other membranes, and then eventually bone. So the root sits just underneath the skin, between the skin and the fat, about 4 or 5 millimeters. And whether I'm going with FUE or whether I'm cutting to get the strip out, I need to see the roots and go just slightly underneath them.